Sure, Doctor.
Yeah. Rick, thank you. First, I want to commend you on your work on this Medicare equivalency issue for this state, because it is hugely important that we be brought up to a parity that allows us to keep our doors open. One of the problems with Medicare, I qualify here as in 4 areas. Number one, I'm happy to report I am a senior citizen. Number 2, I'm a physician who's been in practice for over 40 years. Number 3, I live in Snohomish and practice in Lake Stevens. And number 4, I'm here of my own volition. Nobody paid me anything or gave me a taxi ticket. And I'm not part of a mob or any other organized operation.
Well, as we say, I'm not a member of an organized party, I'm a Democrat. So.
I hope so. In any event, my questions are, I have 2 or 3 questions.
Will Rogers said that.
Right, I have a couple of questions and a comment. For the individuals who want to be part of Medicare, at the current Medicare reimbursement rates, if I had in my practice a huge portion of Medicare, Medicaid patients, I couldn't keep my doors open to take care of any of you or all of you. That's number 1. Number 2, a huge portion of the healthcare reformation, if you will, has to do with cost. And one of the major cost factors, which nobody has mentioned so far, is tort reform. Why does your colleagues, and perhaps yourself, I haven't heard you speak on this subject, why does your colleagues favor a European-Canadian healthcare system, but without the European-Canadian legal system, which is basically a workman's comp for medical misadventures, if you will, some of which obviously deserve maximum compensation, and others of which, of course, are frivolous lawsuits. So I'm curious to know where you stand on tort reform, because in this 1,000+ page bill, there is absolutely nothing that I can discern on this, and President Obama stood in front of the AMA and said he is not going to support any form of tort reform. I have my own ideas why, but I won't ask who's contributing to whose campaigns. So that's my first part of the question.
Oh, well, okay. You can come by the office and give me the second question. With regard, or on Medicare, you mentioned that about keeping the doors open and seeing more folks and so on. Yeah, and one part of the bill that this is actually kind of 4 bills sort of in one. Pages 1 through 216 are it's really the health care reform part of it. Health insurance exchange, public options, so on. Then there's a section on Medicare, Medicaid. The last section is about healthcare workforce. And this gets to the question you have about just being able to see Medicare patients separate from the reimbursement. Let's say the reimbursement comes up. Are there enough primary care physicians out there? Right, there are not. There are not enough primary care physicians, not enough advanced registered nurse practitioners, not enough RNs. And other providers, and so this bill actually has a whole section on improving the primary care workforce, which is going to be a very important part of anything we do. Whether it's this bill or anything else, it's going to be an important part of the bill. So it increases the Medicare physician payment rate for primary care services. Sorry, it's getting that feedback. I apologize. So let me repeat that. Increases Medicare physician payment rate for primary care services, and increases even more for primary care services in rural areas. We have a huge, obviously, rural area access problem. It provides, and then the additional dollars and programs to educate and train new primary care providers. Sort of building on the Nursing Reinvestment Act we did a few years back, to increase educator slots, as well as education slots in nursing schools around the country. We're doing that with physicians as well. And over time, hopefully to bring that ratio down of physician to population, which we use as sort of the marker. Yeah. Oh, tort reform. So I'm gonna have to move on to other questions, but let me do the tort reform. Yeah, I said I was answering the tort reform question. Yeah. All right. So I don't think the president said he's opposed every type of tort reform. I think he did say he didn't support caps on non-economic damages. If tort reform is caps on non-economic damages alone, you and I are going to disagree, right? But I'm getting in a little bit of trouble for saying this. We put a little over $1 billion in comparative effectiveness research through the stimulus package. The idea being to identify treatments, procedures that get us the best quality outcomes in healthcare. And then the idea would be to spread that information out to providers throughout the country. And if we do that, and if providers are in fact using those procedures, then I think we ought to consider some level of liability protection for doing that, because it may be changing the way how things are being done. And I'm not going to. Someone asked what level. I can't get into negotiating that today, and really, I'm not going to be able to answer that question. So I think there's some room for discussion on this. But you're right. There's no tort reform in this bill. There isn't. Has to do with defensive medicine. He's just saying without it, the issue of defensive medicine continues to be a real serious problem for him.